I think I got into medicine primarily because what I went through as a kid. I had a lot of health challenges, saw a lot of healthcare providers, and I wanted to give back when I got older. I think family medicine, the biggest thing was my experience with my preceptor in medical school, and when you were seeing kids from infancy all the way up to adulthood and geriatrics, and over time it just felt like that was right. It reminded me of my family doc when I was growing up, and that's what drove me to family medicine. I would say my approach to patient care is looking at you as a person, not a number, but you as a person. You know, whether you could be, you know, a mom or a dad or a kid or just a struggling teen, maybe you're a retiree. Try to look them at as a person, know them as a person, what they are, what they do, not just someone who has a disease. I'm hoping the experience my patients have when they come to see me in the office is it's more like a home, you know, a medical home, that they know that me and my staff care for them and want to figure out what's wrong and help them through the process. Because medicine, finding diagnoses can be a really challenging and scary process for people. I think what's most rewarding is a combination of the intellectual challenge of figuring out what's wrong, coming up with a treatment plan, and then just making people feel better, giving back, you know, what was given to me when I was growing up. I can now give back to my patients and you know, help them feel better. When I'm out in the office, I'm probably trying to enjoy the outdoors. You know, whether it's going to the Oregon coast, you know, maybe out in the woods somewhere. I like being in the outdoors. You know, the winter months, obviously can't do as much of that with the rain, so I might be just indoors reading a book. Also, my wife and I like to travel, you know, whether it's around the country or internationally. She'll plan some kind of great adventure and off we go to check out some part of the world, whether it be in the US or elsewhere. The other thing we like to do a lot of is we have a lot of family around, you know, in the Portland metropolitan area, and, you know, spending time with our family members. We kind of like to do that kind of stuff. I think what I like about the Corvallis Clinic is we're physician-owned. And because we're physician-owned, we're not having somebody up in the C-suite telling you how long you're going to be seeing a patient, how many you're going to see, and how you're going to treat, or an insurance company that says, you know, no, we're going to deny this. We can actually give the best possible care for our patients, and we're always striving to do that by getting the newest technology and finding treatments that will actually make a difference for the patient. I like that more that autonomy of taking care of patients.